Yeah, I know you're talking. So, some things to to consider, because there's a great deal of range of motion here. This, we're getting measurements farther along the goniometer than you've ever gotten before. 160, 170, 180. So again, don't try to follow things, but the easiest thing is use a little common sense. If you're going to measure flexion, I just ask the patient, I want to just see how far you can raise your arm. So I'm like, okay, she went past 90, so I know I'm not going to be able to use this as an axis. It disappears. I'm not going to be able to use this as a landmark. It's gone. Okay, so I know I've got to use this. So what I will do is I'll say, okay, who's got a goniometer? So what I'm going to do is I know where my axis is. I'm just say, okay, take your arm up over your head. I'm just going to pull my finger away. So okay, this is where it would be if it was still there. I'm going to go down to my olecranon, and now you can see, because the scapula is here, it's actually wedging the thorax up. So below 90, I'm probably parallel with the table, but now I've got to go at a slightly up angle and follow that thorax. So I get a, true reading. And there she's only got about, you got a limitation, she's got about 145 degrees of flexion. So, those are some things that you want to do. First, look at it. If it's less than 90, just go ahead. You can use Norkin and White's landmarks. Make sure the knees are bent up. It's going to be easy to do. But if it goes beyond that, you're going to have to change landmarks, and your axis is going to disappear. So just kind of keep your finger there. Know that you've got now, because what's happening is your shoulder blade is pushing. It's one of those kinesiology things. It's creating an inclined wedge, inclined plane, pushing your thorax at an angle. So you got to compensate for the angle of the thorax. Now, when we're measuring abduction, that's a different plane. Here, sagittal plane. Here's your axis. This is motion in the coronal plane. So you're going to have the palm up, and you're going to have them come up this way here. Okay. Now, here's the medial epicondyle. We know this. We're going to be parallel with this. Now, there are some people who are tight there, and I've seen it on a couple tables, but all of a sudden it started to go up here, and they keep going. But at the point where you've, jumped up off the table, you're now doing flexion. You're compensating for a loss of abduction. So abduction is in the coronal plane. If it starts hopping up into the sagittal plane, you're no longer measuring abduction. So make sure it's in the coronal plane for your endpoint of abduction.
Your hand placement would be like the direction of your hand. Does that matter?
Yeah, palm up. Okay, so palm up, and you can see the roll really good. Okay, but that's still medial, epicondyle with that. There, although it looks like it's lining up. Remember, the rotation is coming below the forearm. Okay, so it looks like this is weird with the medial epicondyle, but it's lining up with the thumb. How can it be? Okay, because you're getting rotation down here below the elbow. It's not happening at the shoulder, so it's still medial epicondyle there. And with your internal and external rotations. Again, you want to make sure that you are identifying where glenohumeral stops. So if you put your hand on the earthquake, see my hand start rocking forward at that point? That's where glenohumeral ends. So I'm going to just kind of back up. So I'm like, okay, that's where it starts. So that's where I'm going to get my measurement for internal rotation. And kind of the same thing you're going to do in reverse. You're going to put your hand back here, and you're going to feel when it starts, and you can see it, when it starts rotating and pushing down into your hands, that's the end of glenohumeral external rotation. It's a lot farther than internal rotation. But at that point, you want to get your measurement. We can go farther than those, but that's the whole complex. And the reason we want to know the complex, remember back at the beginning of the lecture, I said we want to look at somebody's shoulder posture. They have one higher than the other. And those who can't internally rotate, usually one clue is they'll have an elevated shoulder because, you know, do I internally rotate this way or do I internally rotate this way? So if I elevate like this, like we're doing when we go down here and we feel the shoulder rolling up, we can compensate for an awful lot of lack of true glenohumeral internal rotation. You know, so that's why when they measure, they want to know how much of that is coming from the glenohumeral joint, because they might have, the complex might be overcompensating. You can still get back there, but that doesn't mean that you've got freedom of the glenohumeral rotation. So those are things to be careful of. Is, you know, make sure you can identify where your glenohumeral, and usually when you do it, it'll be like, my description is, when you're moving the hand, it'll feel like it's going through water, and when the scapula gets involved, it'll feel like it's going through sand or mud or something like that. So you want to go just to the point where it feels like it's going through water. If you feel resistance, that's the point where it'll stop, and you also usually feel the scapula. So those things there. Make sure when you're measuring abduction, you stay in that plane. Hops up out of that plane, you got to go back down. That's where abduction ended, because now this became flexion. And when you're doing flexion, know that you're, and most of you are going to measure involved and uninvolved sides. So on your uninvolved, very possibly, you're going to have to do that and use this. But on your involved, very possibly it's going to be that. Remember, they're coming to you for a reason. If you're seeing shoulder patients, they're probably not going to be normal. They're going to be asymmetrical. So you will see these differences. Okay, so it is 25 to. I will let you guys clean up if you want and leave, or you can stay here and measure for a little while longer. Remember, we need to practice, and what do we need to do as homework before Wednesday?
Go watch videos.
Watch videos. And maybe even practice.
Okay.